Alzheimer's disease. Alzheimer's disease is a progressive disorder that causes brain cells to waste away and die. Alzheimer's disease is the most common cause of dementia, a continuous decline in thinking, behavioral, and social skills that disrupts a person's ability to function independently. The early signs of the disease may be forgetting recent events or conversations. As the disease progresses, a person with Alzheimer's disease will develop severe memory impairment and lose the ability to carry out everyday tasks. Current Alzheimer's disease medications may temporarily improve symptoms or slow the rate of decline. These treatments can sometimes help people with Alzheimer's disease maximize function and maintain an independence for a time. Different programs and services can help support people with Alzheimer's disease and their caregivers. There's no treatment that cures Alzheimer's disease or alters the disease process in the brain. In advanced stages of the disease, complications from severe loss of brain function, such as dehydration, malnutrition, or infection, results in death. Symptoms. Memory loss is a key symptom of Alzheimer's disease. An early sign of disease is usually difficulty remembering recent events or conversations. As the disease progresses, memory impairments worsen and other symptoms may develop. At first, a person with Alzheimer's disease may be aware of having difficulty with remembering things and organizing thoughts. A family member or friend may be more likely to notice how the symptoms worsen. Brain changes associated with Alzheimer's disease lead to growing trouble with memory. Everyone has occasional memory lapses. It's normal to lose track of where you put your keys or forget the name of an acquaintance. But the memory loss associated with Alzheimer's disease persists and worsens, affecting their ability to function at work or at home. People with Alzheimer's disease may repeat statements and questions over and over again, forget conversations, appointments, or events and not remember them later, routinely misplace possessions, often putting them in illogical locations, get lost in familiar places, eventually forget the names of family members and everyday objects, have trouble finding the right words to identify objects, express thoughts, or take part in conversations. Thinking and reasoning. Alzheimer's disease causes difficulty concentrating and thinking, especially about abstract concepts such as numbers. Multitasking is especially difficult and it may be challenging to manage finances, balance checkbooks, and pay bills on time. These difficulties may progress to an inability to recognize and deal with numbers, making judgment and decisions. The ability to make reasonable judgments and decisions in everyday situations will decline. For example, a person may make poor or uncharacteristic choices in social interactions or wear clothes that are inappropriate for the weather. It may be more difficult to respond effectively to everyday problems such as food burning on the stove or unexpected driving situations. Planning and performing tasks. One's routine activities that require sequential steps, such as planning and cooking a meal or playing a favorite game, may become a struggle as the disease progresses. Eventually, people with advanced Alzheimer's disease may forget how to perform basic tasks such as dressing and bathing. Changes in personality and behavior. Brain changes that occur in Alzheimer's disease can affect moods and behaviors. Problems may include the following: depression, apathy, social withdrawal, mood swings, distrust in others, irritability and aggressiveness, changes in sleeping habits, wandering, loss of inhibitions, delusions such as believing something has been stolen. Preserved skills. Many important skills are preserved for longer periods even while symptoms worsen. Preserved skills may include reading or listening to books, telling stories or reminiscing, singing, listening to music, dancing, drawing, or doing crafts. These skills may be preserved longer because they are controlled by parts of the brain affected later in the course of the disease. When to see a doctor. A number of conditions, including treatable conditions, can result in memory loss or other dementia symptoms. If you are concerned about your memory or other thinking skills, talk to your doctor for a thorough assessment and diagnosis. If you are concerned about thinking skills you observe in a family member or friend, talk about your concerns and ask about going together to a doctor's appointment.